It is my privilege to present the following program that was inspired by the way American businesses and organizations have responded to the events of September 11th. It's part of a special series produced by Heartbeat of America called Keeping America Strong. Each program spotlights a business or organization that is helping to do exactly that, keep America strong. Having served in the United States Navy for many years, I fully appreciate the important role small and middle-sized businesses play in the very fabric of our country, and I salute the professionals who lead these companies and thus keep America strong. They are the very backbone of our free enterprise system, and today on this program you will meet the individuals behind one such organization. I'll be back later in the program to introduce the Keeping America Strong Award. And now, let's learn more about the organization we are honoring today.
Today, the eyes and ears of the 21st century are focused on new developments, new technologies, new emerging companies. We're on the scene to bring it to you as it happens.
We anchor from our new studios in Los Angeles and then go out all over America to get to the heart of the story.
I'm Bert Tenzer.
I'm Bella Shaw.
I'm Doug Llewellyn.
I'm William Shatner, and this is Heartbeat of America. Our show focuses on corporate America, its stories, its drama, its breakthroughs. We'll be going out today to report on an organization that is impacting our lives and shaping our future. An organization that truly is the heartbeat of America.
In the 20th century, a group of future Americans led by William Shatner ventured out into the universe. The challenge? To take the American spirit and courage to the final frontier of man, outer space. It was an exciting time on television, but it was only a fantasy.
It's the challenge to unite America and to keep our economy and our country moving forward.
This has inspired Heartbeat of America to launch a special series entitled Keeping America Strong.
In the 20th century, William Shatner took us off on a voyage into the universe to experience what life is like on other planets. But now, here in the 21st century, he is back to explore what life is like right here on our own planet. This is all part of a new series that we call Keeping America Strong. And as you know, part of Keeping America Strong lies in helping Americans to live quality, productive lives. And for that, we need healthy minds and healthy bodies. And in today's world of stress, it is much more important than ever before. So the question is, how do we achieve that? Well, our guests today have developed amazing technologies that wake up and accelerate the natural healing process of the body. One technology, for example, measures and analyzes the body's energy imbalances and problems, while another, which is a biofeedback electrical stimulation technology, provides the therapy. This is an amazing story of new research and developments that impacts the body's built-in electrical control system. And we're about to find out how it all works. Quite frankly, I didn't even know the body had an electrical control system. And if you're like me, you're going to learn a lot from this. Our guests are from a company called Avazzia, which is headquartered in Dallas, Texas. And I'd like you to meet our guests now. First on my left here is Tim Smith. He is the chairman and founder of the company. He is a former senior design engineer and senior vice president of Texas Instruments.
Yes, sir.
And on Tim's left, we are pleased to have Benjamin Soong, who's the vice president of sales for Avazzia. Gentlemen, welcome. Nice to have you here.
Thank you.
Tell me a little bit about this technology that we're talking about. What really is it? It sounds very, very space age.
Well, it is space age. It's a technology that puts an electrical signal through your skin. It stimulates the C fibers of your nervous system, and it triggers the body to turn on its own natural healing processes, improving circulation in the area of the treatment. Your body also manufactures certain hormones and opiates that are your natural painkillers of the body. And it also stimulates the body to make neuropeptides, which are your body's natural healing elements.
What areas, what kinds of problems would you be suffering from to have this technology be a benefit?
The primary problem that we're focused on is pain. Pain is a $100 billion a year problem in the United States. 1 out of 4 adults above age 25 suffer from pain on a monthly basis. And as we baby boomers get older, more and more of us are going to experience pain.
Right.
And this is an electrical product that significantly helps in dealing with pain.
And I think, correct me if I'm wrong, but as we go along, we're going to learn that this is useful in sports injuries, in various portions of the body, and not only in humans, it's also being used in animals as well.
That's correct. For instance, we have this picture.
All right, let me show this. We have a picture. Go ahead.
This is a young lady that plays on a baseball team, and she's treating her ankle. So it kind of shows it's portable technology that you can use right on the athletic field.
What might she be suffering from?
Maybe she twisted the ankle running the bases.
Okay.
Football player may have hurt his shoulder.
Okay. And they'd be suffering pain.
Correct. Basketball players pound their knees for the whole game, and they can improve the circulation in their knees with this technology, speeding up the recovery from all that pounding.
Well, it's interesting because there are a number of devices you have. Let me hold these up and just ask you to tell me a little bit about what they are and how this works. For example, what would this be?
Okay, that is the body stem. It's a product designed specifically for medical professionals to use in their offices and use in cases where increasing circulation and things to do with the vascular system is real important.
And again, it works on electrical currents in the body. So the back of this device, if you look on the back of it, there are these metal plates. They're shining in the lens there, but you rub those plates over the body.
Skin.
And what's it doing while you're doing that?
It's sending a signal into your body.
Right.
It's measuring the change of the electrical properties of your flesh where it's treating it. It's changing the next signal. That's the biofeedback.
Right.
And it's finding the optimum dosage, and it rings when it's through treating that spot.
Well, that's pretty fascinating. Yeah. There are 3 different devices we have here. Each one has a different use. Is that correct?
The mathematical algorithms that control the signals are different in each of these. This middle device, called the RSI, is for repetitive strain injuries. And repetitive strain injuries would include a golf shoulder, tennis elbow, or carpal tunnel from someone working in an administrative function in an office typing on a keyboard.
Okay.
The carpal tunnel problem in the United States
Huge problem,
is $60 billion a year.
Yeah.
10% of the American workforce have the problem. OSHA says it costs, for a single case of carpal tunnel, about $29,000 of workers' comp cost.
And that, of course, is in the wrist.
In the wrist.
From typing the computer.
You treat the device on the wrist, up the nerve to the shoulder and to the spine.
Okay.
And if treated properly, we believe that this can cause a number of those surgeries not to occur. So a corporation could provide these to their employees that have the problem. It might cost them $1,200, $1,300, but they might save $20,000 of other medical costs. Let's think about how big this is. Nearly half of the communication workers of America have carpal tunnel.
Wow, that's a lot of people.
That's a $7.5 billion workers' comp liability to the communication companies. A huge percentage of the postal workers have the problem. Meat cutters and butchers that are constantly moving their hands have this problem. It's 10% of the workforce in America. It's 20 million people.
And how effective is this in treating carpal tunnel?
Well, we're running a clinical trial right now, approved against an institutional review board setting, so we can talk about it. And the IRB approval says it's not going to hurt the people, so go ahead and run the test.
Right.
Okay, so we're running a test on quite a number of people right here in California, and it's a double-blinded, and it'll be talked about more, clinical trial according to FDA standards, and it should prove how effective. Prior to doing this, we had a preliminary study where 32 people with carpal tunnel were allowed to use our technology with very little instructions. 32 out of 32 exhibited improvement. So we're very hopeful that this is low-hanging fruit that can kick our business off.
Well, that sounds fascinating. I'd like to point out that Mr. Soong is, I know you're the Vice President of Sales. Interestingly, these devices are being used, and not only here, but abroad as well. They're made in America, but you're selling a lot of these in China. Is that right?
Yes, we're selling them in Asia, China, Malaysia, Taiwan, and so forth.
And the results over there, very promising?
Very promising.
We only have a limited amount of time, as you know, but I know that you're going to conduct a demonstration for us in how this works. So, Ben, why don't you come over and show me on a subject we have here exactly how one would use this, okay?
Sure.
Let's try this. If you bring the chair in.
While he's While he's getting that started, set up, we're quite proud of the fact that we do the engineering on this technology and the research on this technology here in the U.S., and we do the manufacturing in the U.S., and we export it to Asia. We're preserving U.S. jobs.
I think that's very worthwhile pointing out. It certainly is a reverse of most of the stories we hear these days. All right, sir, are you ready?
Yes. This device here...
Now, we're going to be looking at the screen and you, so tell me what's going to happen.
Well, what I'm going to do is put a ground on the person being measured here and have her relax. First of all, she must have her watch and things like metal to be removed to minimize interferences. And then I can then proceed with the measurements. First of all, we have to make sure we have the right gender.
Okay.
So I select female, and then I can proceed with the measurement. Now, it is designed to be very easy to use so that it can be performed by people who are trained to do this. All I'm doing here is simply following the red dot showing on the screen. And the chart to the left is actually a stability indicator. What that means is that it takes 250 milliseconds to take a measurement. And out of that 250 milliseconds, only the last 50 is taken for analysis purposes. And for that reason, all we are looking for is the stability in the last quartile of that meter.
Now, this is not painful to you at all, is it? Do you feel this? A little tinge? You're not feeling anything? Well, that's good.
And this device is such technologically superior product that it is used by over 70% of the major hospitals in Taiwan, as well as some of the best medical universities. It is not only used for diagnostic purposes, but also used for various clinical studies as well.
Now, what's interesting is you're only touching, a relatively few points on the body, but he's actually learning a lot about the electrical system in her whole body, isn't he?
The picture on the screen is showing him where to place it, and these are source points for the acupuncture meridians of the body, which are your nervous system. And these are all connected. And the analysis will look at the balance of the data between one meridian and the next.
And there are how many? There's 2,400, something like that?
No, there's 12 meridians.
12 meridians.
But you measure them on the left side and the right side, so you get 24 measurements.
24 measurements. Okay.
Now, with each of the 24 measurements, we actually measure about 4,000 data points and then use statistical correlation to come up with the charts that we're about to show.
So the test is now done, and what are you going to show us now?
And then the next we will go to is to analyze the measurement that we just did. Now, it's color-coded. So if you see green, that means normal. Yellow means borderline, marginally acceptable. And red means pay attention. So on the first screen, it shows the energy imbalances of body energy, mental state, musculoskeletal system, metabolism, and autonomic nerve.
If you can get back on the screen again, go ahead. Repeat that for me. What did you say?
Okay. The first screen shows the state of body energy, mental state, musculoskeletal system, metabolism, and also autonomic nerve balances. And in her case, it's showing there's borderline imbalance with her metabolism and autonomic nerve.
Well, that's, as I said, we have a limited amount of time. That just gives us a glimpse of the kind of information that we can get out of this test. It's very interesting. If you'll come back and sit down, Benjamin, I appreciate it. This is something that is really cutting-edge technology, isn't it?
That's correct.
What do you see for the future of this? Where is it going?
Well, first off, it's significant. Dr. Nakatone at the University of Kyoto developed this theory in the 1950s and the 1960s. It's been automated in the 1990s and now the year 2000. So you take this data, it's very repeatable, it's reliable, and it generates a set of reports that tell a trained physician what to go do to help that patient. With those reports, one can take one of our devices and the machine will actually guide the professional where to treat, to relax an inflammation or to stimulate a deregulated part of the body. So you can basically tune the electrical system of the body to bring it into balance with our technology.
Well, this is pretty fascinating. I want to point out we have three doctors who are about to come out and tell us of their experiences with this. So we will do that when we come back.
Thank you.
Thank you.
We have been watching the operations of an organization which is doing its part to keep America strong, and we've been learning from its leaders about what they're doing to help move our country forward. This organization represents companies across our great nation that embody the spirit, dedication, know-how, and can-do attitude which has made America the great nation it is today. And now let's present the Keeping America Strong Award.
Now it's my honor to present our Keeping America Strong Award to Tim Smith, the chairman and founder of Avazzia of Dallas, Texas, for the outstanding work his company is doing to help keep this country strong. Tim, congratulations and best wishes for success.
Thank you very much. Everyone at Avazzia thanks you, thanks William Shatner and Admiral Delaney. It's a great honor.
Congratulations for earning the Keeping America Strong Award, which honors innovators and leaders like you who are the heartbeat of America.
That's it for Heartbeat of America's special edition, Keeping America Strong.
Now for a final word from William Shatner.
Well, that's it for this edition of Heartbeat of America. I'm William Shatner. Thanks for watching.